Thanks to everybody for being here, and I will turn it over to Scott in just a minute, but just a few points to emphasize as we start is we will be reporting this week on our 6-year graduation rates for the 2014 first-year cohort. And we will report a graduation rate of 65.7% for that group. And that is the second highest graduation rate in the history of LSU. So we're really, really proud of that success. Sticking with enrollment for just a minute, as I have been telling you, our numbers throughout the spring looked very strong. We saw an 18% rise in applications this year, 6% increase among Louisianians, and 25% increase among students living outside the state. And while the numbers are not quite final yet, we are expecting to see a 3.7% increase in undergraduate enrollments this fall to about 26,800 students. That'll mean total enrollment is going to be about 33,000. That's 1,300 more than last fall. We anticipate that the first year class will be about 6,600. That's 10% over last year. We are seeing an incredible uptick in the diversity of the class. There's a 34% increase in first year enrollees from underrepresented groups. Black student enrollment is up 28%. Latinx student enrollment is up 25%. And while we still have a lot of work to do on the inclusion and diversity front, and we're doing that work, this is a sign to us that we are a welcoming place and will continue to be so. Transfers up 10%, and we're expecting our out-of-state enrollment to rise by 32%. ACT average 25.4, GPA slightly up to 3.71, and hopefully next week at this time I'll have final figures on that. But that's good, positive, strong news for us, and we're excited about it. On the COVID front, we are continuing to urge people to get tested. We expect when we report later this afternoon to have a very slight uptick in cases. But again, the key is get tested, get tested, get tested. And as I indicated last week, one of the things that we're doing to stimulate that willingness to be tested is to say those who've been tested will have a priority for football tickets. And Scott, that seems like a nice segue over to athletics. Last week, we announced our football plans shortly after we concluded this press briefing. So I'm really grateful to Scott for saying, hey, I'll come and join you this week and answer questions. So Scott, all yours. And then when you're done, you and I can answer all these folks' wonderful questions.
Thank you, Tom, for having me today. And thank you for all your support during these months of planning for our athletic department. And you've been a true partner, and I want to thank you for it and appreciate all yours and your staff's hard work in conjunction with us. As I mentioned in my initial salvo, we're excited here in athletics right now. It's been a long summer for us, and our staff has been working day and night to this point, and now we can see for us as a staff the finish line as far as starting this thing. Tom, I'm always quoting too much, but to quote Churchill, hopefully this is the end of the beginning, and we're trying to get there, and I feel really good about it. Our goal all along has been to play football safely in Tiger Stadium and do so with fans in the stands, and we're almost there. And our home opener against Mississippi State is a week from Saturday, and I couldn't be more excited. And here again, to throw bouquets out and kudos, really two unsung heroes in our world. Two people that Tom and I have really leaned on are Dr. Katie O'Neill, our own in the medical center and at the Lady of the Lake, and Shelley Mullinex on our staff have been just phenomenal with this COVID-19 protocol and what and how we're doing it and advising us. And not only are they leaders in advising us, They have been leaders in advising the Southeastern Conference. And I know Commissioner Sankey, again, a guy who deserves praise for his strong and steady leadership, has leaned on Katie a lot to do and to advise him on how we should look at things. So here again, it's our own people to brag on LSU doing wonderful things, and it's a great thing to see. On safety, I wanted to talk about that a little more. You know, in order to do this safely, as you know, we're limiting capacity to 25% and mandating social distancing and requiring everyone to wear masks. And before you get there on the why did you come to 25%, it's clear that that's the proper number for social distancing. And we did that in conjunction with the Department of Health and with Katie and with folks that are a lot smarter than me and that know what they're talking about. And yes, we are asking our fans not to tailgate this year. It is something that's going to be different, but it's necessary. And we can do these things responsibly, and we can play football with fans in the stands. But we just have to remember that, you know, here in Baton Rouge, we're still not out of the woods yet. And we have to be very vigilant about doing the three most important things, and that is socially distancing, wearing our masks, and sanitizing. And if we do that, we can get back to it. The other thing that I want to drive home that's obviously obvious to you guys in the media, but not to everyone, is that if you're sick or you feel sick or you have a pre-existing condition, I beg you and I plead with you, stay home. Watch it on TV. It's going to be a great product. I can assure you of that. CBS and ESPN are going to have great coverage as always, and it's going to be fun to watch. And I think we're going to have a nice team this year. But as always, if you have questions, because things change hourly, daily, weekly, hit our website and look to it, because it's robust and it's very full of good data, and I urge you to do that. And I guess that's all I have, Tom. And I want to thank you for your leadership and your support during this thing. And as always, go Tigers! And I'm happy to stay and ask or answer any questions that you may have at the appropriate time.
Thanks, Scott, and thank you for your support too. It's a mutual admiration society. So questions?
All right, we have Glenn Gilbo up with a question.
Yes, Scott, what are your thoughts on what Coach Orgeron said yesterday about most of the team having had COVID, and this after that original 30 in June, and then we heard of a lot of preventative measures after that. Is that how do you see that most of the team having it already?
Yeah, the beauty of this is, Glenn, is that Coach O is totally transparent and honest to a fault, and it's a great thing. This is very similar to what we're seeing across all schools that have been doing this. And look, I'm not going to get into numbers, and I'm not going to get into cases, but I can assure you one thing, and I have President Galligan here looking over my shoulders. They're getting world-class medical attention, and they're getting world-class oversight. And I'll argue and I'll contend with anyone that we have the best contact tracing system in America, maybe second only to the Secret Service, but it's really good. And our kids have been healthy and have gone through it. And frankly, you know, I think we are doing great things, and I'm really pleased with how we're doing it. But that's all I'm going to say on it. I'm not going to answer a bunch of follow-ups, Glenn, because like I said, Coach O was a bit too transparent and a bit too forthright, and I'm very pleased with where we are.
Well, just one more. Why so many after the initial 30 when y'all kind of clamped down?
Well, you know, look, here again, last question. This is anecdotal, and this is Scott Woodward's opinion. I think the vast majority of them have happened socially, and I'm very comfortable, even though there's no parallel or longitudinal study, that I don't think they received it in practice or in our weight rooms. And I think the protocols were good. I think it's just like with all of that demographic, whatever it is, 18 to 29, it happened in a vast way, and the spike for the most part happened socially. Now, hear me loudly and clearly. I'm not an epidemiologist. This is just one man's opinion who reads a lot about it.
Socially meaning around this, not necessarily Tigerland, just normal behavior, you think?
Wherever they are, we only have them 20 to now 40 hours a week. We don't have them 24/7. So that's probably, the vast majority of them. But here again, hear me loudly and clearly. That's one man's opinion.
All right, we have another question from Matt Houston at WFB.
Yeah, questions for Scott. I want to know ultimately how many season ticket holders decided they would opt out and not attend the games this fall, whether they're opting to get a refund on their tickets or put it toward next season's, and then what that tells you about fan expectations for this year.
Great question, Matt. I don't have the final numbers on the second go-round, as you well know, but the first go-round, 53% of our 71,000 season ticket holders opted out. And so from there, the next group that we had a deadline for, I don't have the specific numbers, but I think we're getting there on attrition to where we don't have to do that, and we can get to our 25% number. Do that, I mean cut them back. But we're looking at people with multiple tickets to make sure that there is a priority, that they get to come, but they don't necessarily get all of their tickets. And I think for the most part, it's working out pretty well. And your latter question, Matt, did you have another one?
Yeah, just what does that number you think indicate about the expectations for this season and the fan experience, knowing that number of fans have decided to take a year off and come back next season?
Yeah, I think it says a lot of things. I think, first of all, people are taking this virus seriously, and elderly people and people that are compromised are obviously going to be the first ones to back out of it. And then secondly, the experience is going to be different. We expect it to be different. No tailgating, different types of protocols, wearing masks. That's gonna have an effect on fans. And we just, for the hardcore guys that don't have issues and that will mask up and that will come, I think it's going to be as good experience as we can do for them. And we're going to try like heck to make it as normal as possible while practicing health and safety.
All right, Sydney also had a question about tickets. Was that answered, Sydney, or do you have a follow-up?
That actually was my same question, but I will ask, and maybe this is for Mr. Galligan, but, last week you kind of teased that there'd be a testing initiative for student tickets, and you said you'd have to kind of see how they would prove that. Can you kind of walk through how students will be proving that they were tested to kind of get that priority?
I can. What we made at Sydney was we didn't make it a requirement. We made it a priority. And so if students choose to be tested, they're going to have a priority for the testing. And we will know who's tested, and from some of the testers. So the vast majority, it'll be very, very easy for them to prove. They'll just say, I was tested. We'll be able to verify. And any others that may be tested somewhere else or somewhere off campus, we'll look at their proof and we'll go from there. And again, Sydney, the motivation for it is just get tested.
All right, the next question we have is from Harrison Golden with WVLA. Right there, Harrison? All right, he may have dropped off. We can come back to Harrison. How about Brooks at the Advocate? Brooks?
Hey, question for Scott. Scott, Now you were saying with Ed Ogeron, he was maybe too forthcoming with some things. I mean, we appreciated the forthcoming on some of the numbers there. I mean, with numbers and things like that. I mean, why wouldn't there be more forthcoming there on that? We appreciate the numbers and things like that. I'm sure it's not an easy question to answer or anything like that, but I'm just curious about some of the numbers and reasons on that.
Yeah, I mean, two major reasons, HIPAA and FERPA. But here again, you know, it doesn't tell the whole story, and I'm not going to get into talking about everyone's medical history. And Tom hears it all the time from me. It's a great Benjamin Disraeli quote. There's lies, damn lies, and statistics, and we're very careful with it. And as long as I think we have the proper oversight of what we're doing, I think we're in a very good direction, and I love our program. I think it's our COVID protocol is robust and good, and the kids and their parents are happy with it, and I'm happy with it, and I think that's it speaks of how and what we're doing things.
Is the full story kind of reflected in what you've said previously from other questions?
Absolutely.
Okay. All right, thanks.
All right, I think Harrison's going to try to ask again. Harrison, are you there? All right, he said he may be having trouble and would type something out if he needed to. The other one we have, Patrick Madden is asking, it's similar to Gilbo's question, but Patrick, is there another thing you want to ask about it?
Yeah, and I'm sorry my video is not working. You know, we've seen there was someone, I think it was Penn State, talking about, you know, the heart issues for players. I mean, are you concerned at all about if a lot of these players have tested positive about any long-term effects that, you know, COVID may have for them for heart functions or respiratory issues?
Yeah, we're always concerned about it. And, you know, you brought up an excellent point. And here again, journalists, pay attention. The Penn State doctor was an orthopedist who was erroneously stated facts that there was a vast majority of kids that had myocarditis. Total BS. And you know it. And Brooks, I see you shaking your head. It was discredited and shaking your head in the affirmative. It was discredited, and it was showed that was not the case. So that's why there's a ton of misinformation out there that you have to see it. But yes, we're monitoring these things. We don't know. We're early into this this virus, and we're watching it very closely. And that's why I'm not going to sit here and debate and argue epidemiology or virology. That's for people a lot smarter than me to do. But I feel very comfortable with the guidance and the leadership of Dr. O'Neill and Shelley Mullinex of where we're going on this thing. And I think our kids are in a very good place.
All right, I may have skipped over, my apologies. Mark Ballard had a question that's probably more directed to President Galligan. He typed in here, how are you handling quarantines to hotels when hotels are filling up with hurricane evacuees? President Galligan, would you like to address that?
Yeah, that's a great question, Mark. We still have some students who are quarantined in hotels. We have others who are quarantined in LSU apartments. Some are quarantined in place in their residence halls. And of course, some are still quarantined, have chosen to quarantine at home. So we've really given it student choice. What does the student want to do? Right now, we have 47 in isolation and 107 in quarantine, and that's in the LSU affiliated spaces. So obviously the Laura had a significant impact on Baton Rouge hotels, but the situation seems, at least for us, to have stabilized, and our Res Life people have done a fabulous job of opening up other spaces on campus. So good question. Thank you, Mark.
And then we have another one for you, President Galligan, from JC at the Louisiana Illuminator. He was asking for an update on students or student organizations being disciplined. I think we touched on that a few weeks ago for unsafely socializing or not following the protocols.
We did, and JC, I don't have new numbers on organizations or people going through the SAA process. We can get you those numbers. The numbers are not huge. I will anecdotally say that I was riding through my neighborhood the other day on my way home from the BSAA Unity March and saw a group of cars and with LSU parking stickers. And so I not stalking, but I noticed and I mentioned it to a friend, and the friend said, well, can you identify them at all? And I could. And guess what? It was a registered student organization that had a registered social activity that had been approved by our campus. So I am pleased that at least that student group is following the protocols and doing the right thing.
All right, and President Galligan, Catherine from the Reveille is asking about the student testing priority for tickets. She's asking, are student tests prioritized regardless of date? And I think we included
yes.
semester.
Yes. All at this point, all you have to do is say, I've been tested. So it doesn't have to be 2 days before the game, 3 days before the game. If you've been tested, then you are in the priority line.
Yeah, and I think we put August 15th because that was the day that students started moving back. So tested as of August 15th.
I think that's right.
And then Harrison's question was for Mr. Woodward. Is there an idea of how much projected revenue will be lost at the stadium with the result of these measures were taken with the pandemic?
Yeah, it's too early to tell, but preliminarily I can talk about it's going to be in the tens of millions of dollars. And it's in the mid-range of that. It's a serious number, and we're working hard to try to figure out both from a revenue and an expense side how to manage this one-time force majeure event that we call COVID.
All right, and Matt Houston at WFB has a follow-up question.
Yeah, my follow-up's for President Galligan. Because the testing prioritization is regardless of date, I mean, does that do enough good given that a student could test negative in September and then come back in December and go to that Ole Miss game and have caught it at some point, 3 days prior to the test? I mean, why that directive from the incentive without the date calculation?
Yeah, and Matt, because again, the first and foremost, we want to get people tested. So we were not going to put rigid timelines on it, but you jumped ahead in time to the Ole Miss game in December. And Matt, one thing we have realized throughout this whole experience is we got to turn, we got to pivot, and we got to adjust. So what I'm saying today about getting tickets for Mississippi State, that as long as you've been tested after August 15th, you have priority. We may move that priority date as the season goes on. I.e., okay, if you were tested in September, you got to get tested again closer in time to the December football game.
All right, that's all the questions so far in the chat. Does anybody have any other questions for the president or the athletics director?
Ernie, I'll go again for Scott. If I'm just curious on your decision, Scott, your opinion on the Big Ten's decision to kind of reverse course here, and what do you think led to the decision? And were they a little too early to make their decision in the first place when they called things off, I guess about a month and a half ago?
Yeah, on the latter, I think you asked a rhetorical question, so I'm not going to say any more on that. But I want to stay positive with this, Matt, and just show you, for a guy that was criticized early in the process, Greg Sankey has been a steady hand, and he's gone about this properly, day by day, listen to the experts, and just always ready to pull the plug if there's something that we cannot overcome. And he's gone through this process in a very thorough and proper way. And in my opinion, he's the unsung hero on this. So, I say it in a positive, that the SEC and Commissioner Sankey got it right. And I'm very proud to be a member of this league and what and how we do things.
Yeah, I'm gonna bootstrap on that, Matt, if I can, and say that that the commissioner's been fantastic. That the presidents and the chancellors, as well as the athletic directors, are meeting once a week. This week, the presidents and chancellors are meeting twice. We're getting information from the medical task force, and I will pat Greg and my colleagues on the back, and Scott and the athletic directors. Moving to September 26th was a great decision, because it gave us 3 more weeks to learn and to hone and to get even better.
All right, we have one more from Mark Ballard. He's asking, what other than asking students and faculty and staff to fill out the daily COVID symptom checker, he said, other than asking, are you collecting people who have been tested? Is it just voluntary? Any thought on making testing mandatory?
Yeah, we're still, Mark, we're still asking, begging, pleading, imploring. As we see people in quarantine, we're going to begin testing people more aggressively who are in quarantine. And as we get the data from our wastewater treatment that we discussed last week, if we start to see hotspots, then we may well mandate that students in those hotspots go get tested. We're not mandating yet, but there is thought and constant discussion about when that may be necessary and under what circumstances.
I have a question for Mr. Woodward regarding student section. I know students will have they'll be assigned to a specific seat, but will they have to space out? Will it be like every other, or how will that social distancing look like?
Yes, exactly. You got it right. And the social distancing will be the same as the stadium.
So there could be like 5 seats in between people, or?
Yeah, 6 feet, whatever that is. Yep.
All right, one more from Mark concerning Coach O's revelation about positive tests on the team. When were you made aware of those results? Is that for Scott and Tom, or one of the other, Mark?
I'll take it. Mark,
sure, either one.
I'm aware of it daily. I know usually how many people are positive, how many people are in quarantine, and how many people are in isolation.
I think it's probably similar for the president. He's getting numbers every day as well. Anybody else?
We get numbers. We get numbers every day. Same. How many positive? What's the growth? How many in isolation? How many quarantine? And how many active cases?
Well, as far as the football team goes, how many are in each of those categories? Today. Yeah.
Oh, I couldn't tell you. I didn't get them today, but yesterday it's in the single digits. And Mark, I told everyone I'm not answering specific questions about this. I'll talk generally about it, but we're not going to get into a numbers counting game from our end.
All right. Do we have any other questions before we wrap up?
Can I sorry, this is Patrick Madden again from WWNO. I understand why you can't get into specific numbers, but what is I guess the question is, why can't we share numbers publicly at least once a week or something for, like we would with nursing homes or other kind of places like that, considering this is a public health emergency?
It is, but we feel like we have plenty of safeguards and that we're under very good protocols, and we are following and communicating with the departments of public health and the right authorities on everything we do, from up the chain in the university process, as well as with the proper authorities.
Thank you.
Scott, if I may.
Question from Rob Masson from Fox 8 News. He's asking about the stadium capacity and alcohol being served or not.
I'm sorry?
Rob from Fox 8 News is asking about the stadium capacity and if alcohol will be served.
No, alcohol will not be served the first game, and I'm hoping if we show that we can do things properly in what we're doing, that we can get to the point of later being able to do so. But there will not be alcohol served, and capacity I covered is 25%.
And Catherine from the Reveille is asking if there's any incentives for non-student season ticket holders to be tested as well.
No.
We encourage it.
All right, does anybody have any last minute questions while we're wrapping up? Rob is asking, do we have a number? How does the 25% equate as far as students and general attendance?
It's proportionate to the maximum capacity. It's based on the is it the numerator or the denominator? My math's shaky. It's the same as 25%.
Yeah, I think it's
of the current capacity.
I think it's 2,200 student tickets, about that number. Am I right?
Sounds right.
Yeah.
Ernie, I have one last one for Mr. Galligan. After kind of announcing this incentive to get testing for students, have y'all seen a spike in the last week of students going to get tested?
I think we've seen an increase in the number of tests. I haven't seen the numbers today, but I have anecdotally, Sydney, as we've driven around and looked at the test sites, it seems like there's more people 6 feet apart waiting in line to get tested than there were last week. So that's a good thing.
All right, well, I think we've reached.
Wait, Ernie, can I ask one more? Sorry, I was trying to type it, but I couldn't do it fast enough.
All right, we'll take one more from Mark Ballard of the Advocate newspaper.
Well, and I want to change the subject just a little bit, or the issue is that when is the committee that's looking at the building and street names with possible racist overtones going to report which names they want to change? I guess President Galligan.
Yeah, thanks, Mark. That committee had its inaugural meeting yesterday. They're going to meet again next week. I would imagine they will meet regularly thereafter. I asked them to be expeditious, but I also asked them to consider the issues that they will be discussing carefully, fully, and that if they wanted resources from archives, from historians, that they should avail themselves of those resources. And the committee facilitator said, we'll get back to you with a timeline after this meeting, and they haven't gotten back yet. So we will call you or let you know next week when we expect to have something. But I've encouraged them to both be expeditious, but also to be thorough.
Have they come up with a definition of what is racist enough?
They haven't come up with a definition. What I've been saying is to take a look at names that are a reminder of a segregated and racist past, particularly names that may be a symbol of that past and that give a signal today that we are not as welcoming an institution as we could possibly be. So I'm sure they'll take a look at what I've said and what the board has said in coming up with their criteria for removing a name.